This video is part of the Infocare tutorial videos, which are designed to provide step-by-step instructions on how to perform cognitive, sensorial, physical and reminiscence activities remotely and through digital devices, as a caregiver of a person suffering from dementia. This video is specifically designed for people with early dementia, and it explains how to perform the sensorial activity called common object smells and textures remotely with the person you care for, by using Amazon Echo Show device. In order to carry out the activity, make sure you are connected with the person you care for by using the drop-in function. For detailed instructions on how to use it, check the Infocare Digital Literacy for Caregivers of Dementia Patients manual, as well as the drop-in video tutorial. With drop-in, the person with dementia does not need to pick up the call to get connected, easing the process. However, other software and devices for video calls can be used. Plan the activity in advance. Watch and learn from the next steps detailed in this video before starting the activity, rather than watching and doing the activity at the same time. This can smoothen the interaction and make it more efficient. Try to maintain a constant schedule and routine. Choose the most suitable time and frequency, depending on the person's needs, daily schedule and routines. Inform the person about the activity and timing before it takes place. If the person is being aided by an external carer or professional, may want to carry out the activity while this person is present. When you are connected, you can normalize the interaction through the devices by starting a conversation as you would do if you were both physically present in the same room. Use short and straightforward sentences, positive and simple language. Make pauses and adapt the pace if needed. Establish some simple rules and structure the dialogue, as example. Start with, "Hello Dad, it is me, John. How are you today?" Finish with, "I will call visit you tomorrow." Avoid those questions that might generate frustration, such as, "Do you remember me? Do you know who I am?" Be flexible and patient. If the activity is not going on well or the person is not interested, switch the topic and relax the environment. Common object smells and textures is a sensorial activity that can elicit positive memories for people with dementia, bringing them comfort and ease. The activity consists of choosing commonly used items that have distinct scents and textures which the person could identify and differentiate. For instance, these items can be herbs that they used to use in their cooking and/or different fabrics e.g. velvet, cotton, satin. Once the items are selected, they can all be placed in a box to create a collection of items to be used for the activity. This sensory box must be placed in safe and easily accessible location for the person with dementia. An identical sensory box should be used by the caregiver. Once both the caregiver and the person with dementia have the box, the activity consists of engaging the person with dementia in a conversation about the items, by asking questions such as, "What is the name of this item? Do you have an item like this one in your box?" The caregiver brings an item out of the box and shows it on the camera to their loved one. Other questions can be used like, "What is the object used for? How does it smell or feel like?" Besides memory, this activity can also reduce anxiety and agitation, bring calm and stimulate the visual and tactile sense. Depending on the level of mobility of the person, it can also help with physical stimulation. In order to perform the activity remotely with a digital device, make sure the following prerequisites are met. Both devices are connected through the drop-in function or a video call, in case you opt for another digital device. The person can listen and see you properly through the screen. The person is relaxed and motivated to engage with the activity. 2 identical sensory boxes. The selected items can be placed in a box, e.g. a shoebox, and so the person with dementia can easily find them by getting directions to locate the box. The caregiver should also have an identical box on his end. Tip: if the person with dementia has vision and/or hearing problems, make sure they have their glasses or hearing aids in hand. Tip: if you use Amazon Echo Show in advance, while setting up the device for the person you care for, make sure the volume is correctly set and the device is paired with your mobile phone, as well as that the drop-in function and permissions are correctly set up. Activity instructions and tips. After setting up the devices and making sure the person is responding, you can start encouraging the dialogue and gradually engaging the person into the activity with questions such as, "Can you find the sensory box? Can you bring it and show me the items? How does this fabric feel like? How does this herb smell like? Can you put it back in its place?" Although the suggested time for this activity is 20 minutes, you can adapt it according to the level of impairment and how well the person interacts through the digital device. If the person starts feeling anxious and you notice the activity is too challenging for them, you can stop the activity and reconduct the dialogue to a topic that is more pleasant for the person. To personalize the activity, you can also add different levels of difficulty. If the person has limited physical mobility or is living in a care center, you can just show them pictures of the objects through the device instead of asking them to find and bring the sensory box. If the person is still living in their home and can move, you can ask them to help you create the sensory box. They could move through the house, find and collect items for the sensory box. When the sensory box is finished, you can make a list of the items that your loved one collected and make an identical sensory box for your own to have in place. You could also ask them to bring the sensory box before starting the conversation, and put it back in its location once the activity ends. If the person is responding well to the activity, you can increase the number or the difficulty of the questions, for example, by asking them to describe the process and connect items in the sensory box with routines, uses and memories. What kind of clothing are made of this fabric? When do you usually wear that kind of fabric? How many items made of this fabric do you have? Amazon Echo Show devices have been used within the Infocare project framework for informative and training purposes. There are other digital devices that offer similar functionalities to ease the remote implementation of stimulation activities for dementia. Some examples are other virtual assistants, such as Google Nest Hub and local assistants in some countries. Video call software supported by smartphone, computer and tablet. Some examples are Zoom, Google Meet, Skype or WhatsApp. As a caregiver, you can choose the most suitable option depending on your preferences and the level of cognitive impairment of the person you care for. Thanks for watching.